Hello everyone, welcome to part A of a two-part video. We're just going to talk about the preliminary concept in pharmacokinetics 1. So this is just an introduction to basic pharmacology and pharmacokinetics. Okay, firstly there's two different definitions, pharmacokinetics and pharmacodynamics. The way I memorized it is pharmacodynamics has a D in, so it means what the drug does to the body, the D, what the drug does to the body, and pharmacokinetics is just a different way around. It's what the body does to the drug, and this is an introduction to pharmacokinetics. So what the body does to the drug. So what is a drug? A drug is just a potential toxic substance that alters a physiological process. Okay, so route of administration of drugs. So most of the drugs are delivered orally. Therefore, they must pass through the gut wall and enter the bloodstream. The absorption process is affected by many factors, but is usually proportional to the lipid solubility of the drug. Later in this lecture, you're also going to see about the lipid solubility, and especially in part B. But yeah, the absorption process is affected by many factors such as the food that the patient ate and things like that. But the biggest factor is the lipid solubility of the drug, so that the drug can diffuse through the lipid bilayer and distribute into the targeting tissues. So therefore you want, but we'll talk about this a bit later, maybe in part B. Okay, so intravenous delivery of drugs, also with an IV, is the quickest way to get the drug to the target tissue because you'll bypass the stomach and the liver and even the stomach enzymes and things like that. Oral drugs usually takes about 30 minutes before any relief is provided. Yeah, because of, it sits in the stomach. Okay, so then also a very important definition is bioavailability. It is a term to describe the portion of the drug used that reaches the systemic circuit. Which meaning if you use 10 milligrams of a drug, let's say morphine, and you administer it orally, only about 2.5 milligrams of this drug will reach the systemic circuit because it's something which is known first pass metabolism. Also, we'll talk about this a bit later. But that is what bioavailability is the amount of drug that will actually enter the systemic circuit. So it's the portion of drug that will actually reach the systemic circuit. Due to metabolism and things like that, not all of the drug that you administer orally will reach the systemic circuit or circulation. So the bioavailability of a drug is 100%. If an IV is used. So when you use intravenous injections, bioavailability is 100%, meaning if you use 10 milligrams of morphine in an IV, 10 milligrams of morphine in an IV will reach the systemic circuit or circulation. So drugs delivered orally will have different bioavailability based on different patients and different types of drugs that you use. So your drugs like morphine that is subjected to a high first pass metabolism in the gut and the liver will almost be inactive when it reaches the systemic circuit. So things like morphine, you can't really use it orally, it must be intravenously. Okay, so therefore bioavailability is very important in oral drugs. You have to understand that there is something such as bioavailability, and not all the drugs you administer will reach the systemic circulation. Then yes, also some nice definition about bioavailability, which is also interesting, is it's not only the amount of drug that reaches the systemic circulation, but it's also the rate at which the drugs appear in the systemic circulation. So it's the amount as well of the portion and as well as the rate. Then there's also a definition, bioequivalence. This is just when two drugs are pharmaceutically the same and their bioavailabilities are the same, then they are bioequivalents or equivalent. Then there's also a nice nice picture. So oral administration, the first pass metabolism will be the gut metabolism, food, the liver metabolism, and blood flow. So yeah, I just wrote also that it will be affected. So oral administration will be affected by first pass metabolism, which means the bioavailability will be lower. Whereas if you use intravenous administration, the bioavailability will be 100% because they will not be affected by the liver metabolism, gut flora, blood flow, or food, because it's straight into the systemic circulation. There's also a nice figure about what first pass metabolism is. I also wrote the oral administration. This is what happens when oral administration is used. Is some of the drugs are destroyed in the gut, some are not absorbed, some are destroyed by the gut wall, some are destroyed by the liver, and then the bioavailability will be low. And this is part 1. Part 2 will part 2 of the video series will we will talk about the pharmacokinetic process, the absorption, distribution, metabolism, and excretion. So yeah, thank you for listening to this video. If you found this interesting, stick around and watch part 2 as well.